I had terrible stomach pain, and it just wouldn't go away. I asked my wife at 1 o'clock in the morning one night to take me to emergency. And I told her I wanted to go to UI Health.
He came to us kind of for a second opinion. And then we discovered that he had cancer, and that was what was causing his obstruction.
It was a colon cancer that I had, and it was in 5 different places. It went straight in the navel, and then it circled it. And that's where all the pain kept going around my stomach. So they had to do surgery.
He had a laparoscopic right hemicolectomy to remove the cancer on the right side of his colon. And so because of his obstruction, I couldn't just remove it and reconnect it. If I was to connect them again, it will put him at a very high risk of leaking. And so we decided to remove the cancer and then create an end ileostomy. We bring out a loop of small intestine through the abdominal wall. And we do that so that we allow time for the intestines to decompress and come back to their normal size. And so he was with an ileostomy for a couple months, and we then, after a few months, reverse them and put them back together.
And then I met Donald after his surgery. He came to my oncology clinic. He didn't end up needing any radiation or chemotherapy or systemic therapy, so we were able to transition him to a surveillance plan where I became his oncologist, kind of managing his postoperative oncology care.
This is the greatest experience that I've ever had medically in my entire life. I mean, beyond the medicine and the help, they're just wonderful, wonderful people.
One of the things that we think is really important is communicating and multidisciplinary care. Whenever I see patients in the clinic, I usually send a message through our electronic medical record updating, this is what we discussed, are you in agreement? Before we even often see the patient, we'll discuss the patient at our tumor board, which includes our surgeons, our radiologists, our pathologists, our oncologists, and we discuss the patient's care as kind of a continuum of care.
I remember when I couldn't lift 10 pounds. Now I'm doing 4 and 5 miles a day, walk. I'm working out in the gym. I have a whole new life. And UI Health is at the foundation of that new life. I really love these people.